Hi there, welcome back. Today's mini lesson is STOTT Pilates Warm-Up and Biomechanical Principles. It's great for teachers getting ready to take their exam and/or students that want to deepen their awareness of the Pilates movement principles. Let's get started sitting on the side with a nice tall spine. And we'll go through 2 styles of breath today. As we find a tall spine, start to soften the shoulder, soften the jaw, and then exhale, round or flex over the legs, feeling that release in the upper body. Inhale, back body, stay there. Exhale, core, low back, hug in and up as you roll tail to head. Let's try it again. Exhale, lower the chin, flexing over the spine, flexing over the legs. We'll feel the exhale engaging the core to draw the spine down, and then inhale, back body, that expansion. Exhale, restack, tail to crown. The opposite, now we're going to inhale as we lengthen over the body. So it's an inhale to roll it down, head to tail. Stay there, pause as you exhale, feel the core kind of draw in and up. Core engagement with this flexed spine is easier to access. And then inhale, lengthen, tail to head, restack. Let's try it again. Exhale, tuck the chin, round over. Or inhale, tuck the chin, round over. Exhale, engage the core, stay, feel that connection. Inhale, lengthen, restack. So great to work with clients, both the exhale to roll over and the inhale to roll over, to just feel the difference of like, oh, inhale lengthens and it opens the back body. Exhale helps activate the core or draw the ribs in. Perfect. Let's take it to the next STOTT principle. We're coming down for pelvic placement, lying on our back. Bringing feet hip width apart, pelvis neutral. Those ASIS you can feel with the heels of your hands, and the pubic bone can be felt with the index finger or middle finger, pubic symphysis. And with that neutral pelvis, take a deep breath in. Inhale all the way down to pubic bone, tailbone, pelvic floor softens. And then as we exhale, there's this deep core activation, and those hip points draw up towards the low ribs. Low back comes down. Inhale, releasing that. Exhale, hip to rib connection, or you can think those hip bones kind of absorb into the body. We want it to come from the pelvis on the femur versus just the low back. And I know they work together, but it's a nice awareness for the client and student to feel the pelvic alignment. Let's try a hip roll. We inhale, prepare. Exhale, tuck the tail between the legs, start to roll up, tail to head, mobilizing. Pausing at the top. Inhale, lengthen the front of the thighs, lengthen the knees forward. Exhale, deep core activation, head to tail roll down, one vertebrae at a time. So the breath here, we can alter it. What we want the client to ultimately feel is the inhale is lengthening and expanding, and the exhale is deep core activation. Let's take it next to rib cage placement. And the first way we'll look at this is the scapula moving around the rib cage. So let's take the fingers to the sky, neutral pelvis, and we're just going to start to extend the fingers up. So lengthen, broaden that middle back. You'll feel your shoulder blades and scapula glide around, and then they draw back towards the spine, gliding to midline. Good. Inhale, lengthen. Back body breathing, and then exhale, shoulder blades glide towards one another. The spine can move a little bit. There's a natural flexion of the spine with that protraction and a natural extension of the spine, thoracic spine, as the shoulders retract. And then we'll bring it into unilateral with rotation. So one arm will now reach to the sky as the other elbow, like bow and arrows, back. So think Katniss Everdeen. One arm is reaching. We want that T-spine to be able to mobilize and move around the axis. And then allowing the hands to release, imprint the pelvis on the exhale. Let's take the headrest, lift it up one notch. Spinal rolls. So we'll take the hands to the shoulder blocks or to the bed of the reformer behind you, And then lifting one foot to tabletop, let the other follow. We want to now practice the rotation of the pelvis with connection to deep core. So feet and knees will hug in. We'll inhale, slowly lower the knees to one side, like a little steamroller with the back of the pelvis there. Exhale, pull it through center, engaging the deep core. Inhale to the other side. Exhale, engaging the core. Knees can draw towards one another or gently press. Activating the core, obliques, deep core, transverse to pull it through center. Inhale to the other side. Exhale, pull it to center. Inhale with control, lower to the side, like a little clock. You can take this with clients and lower to the side and then extend one or both legs to lengthen the lever, bend the knees, come back. Release the feet down. Next, we have head and cervical placement. So we want to think chin and forehead are level. There's a sense of ease and relaxation or less tension in the neck and shoulders, of course. We can always initiate that release by taking a deep breath in, having the client, student take a breath in, and then exhaling, releasing out the tension, softening jaw, softening shoulders. We want to start by releasing the chin down for the inhale, and then reposition the neck to neutral. Exhale. And again, inhale, release the chin down. And exhale, reposition. And you can change that breath. We could take it to an ab prep where we inhale, prepare. Exhale, release the chin, slowly extending through the fingers, lift the head and shoulders up. Ribs knit together, ribs connect to the hip. Inhale, pause. Exhale, roll back down. And try it again. Inhale, exhale, spine flexes, shoulders protract. There's an extension. And inhale to pause. Exhale, slowly roll down. And then the final one here on the reformer is hip, knee, ankle, foot placement. So we're looking at having the feet sit bone distance apart, heels on the foot bar, feet are dorsiflexed, just to keep that nice balanced activation of all the hip muscles. And inhale, prepare. Exhale, lengthen out. Inhale, slowly draw it back in. You can always reverse the breath. Legs can be adducted occasionally, but if the legs are always adducted, there's two things that happen. The lumbar pelvis gets, the lumbar spine and the pelvis have a restricted capacity as we lengthen out, and it doesn't access the muscles around the hip as much when it's just in this neutral parallel alignment. Lifting the hands up there just so you can see. You can have a client, if they tend to knock knee, put a prop between the knees or a band on the outside of the thighs to feel that awareness. And good. And then we're ready to start our reformer warm-up. So that's a great breathing, pelvic placement, rib cage placement, for head and cervical placement, final hip, knee, ankle, foot placement. Thank you so much for practicing together today. I'm preparing for my exam after teaching for the last 15 years, so it's great to be a part of this series together. Let me know if it was helpful.